Dr. Helen Rodriguez Trias was a Puerto Rican pediatrician and women's rights activist who dedicated her career to improving public health, particularly for underserved and marginalized communities. She was born in Puerto Rico in 1929 and moved to New York City with her family when she was a child. After living in the U.S. for years, she earned her medical degree and became known as Dr. Rodriguez Trias. She worked at various hospitals and clinics in New York City and Puerto Rico, where she focused on improving access to healthcare for women, children, and poor communities. She was a founding member of the Committee to End Sterilization Abuse. She also advocated for HIV and AIDS patients during the early years of the epidemic. Throughout her career, Dr. Rodriguez Trias held various leadership positions in public health organizations, including serving as the first Latina president of the American Public Health Association, which let her become famous advocate for women's health. Due to her important work for improving the health of many women, she received numerous rewards and honors for her work, including the Presidential Citizen Medal in 2001, which recognized her lifetime of service to public health and social justice. Sadly, shortly after, Dr. Rodriguez passed away in 2001.
Social impact. Dr. Helen Rodriguez Trias significantly improved the health and well-being of women in general, but particularly those from underserved and marginalized communities. Her advocacy for women's health and rights helped to raise awareness of issues such as reproductive health, domestic violence, and the forced sterilization of women of color. As a pediatrician, she also worked to improve the health outcomes of children, including those of young girls. These efforts helped to expand access to healthcare services, helped to ensure that women and girls received the care they needed to stay healthy. In addition, Dr. Rodriguez Trias was a strong advocate for HIV/AIDS patients during the early years of the epidemic in the 1980s, when many people faced discrimination and stigma. But her work helped raise awareness of the needs of women and girls living with HIV and AIDS, as she would advocate for policies and programs that would provide them the care and support they needed. Overall, Dr. Rodriguez Trias' advocacy and leadership had a significant impact on improving the health and well-being of women in the medicine field.
Some other social impacts she had was that she worked as a pediatrician to commit to the study of medicine, and she helped children in the process. She also created the first care center for newborn babies in Puerto Rico, and that made their mortality rate 50% lower. Uh, she led the committee to end sterilization abuse. Uh, so she made it so you like required consent, uh, terms written in the person's language, and you had to wait between consent and sterilization. And she also had a major role in reproductive health efforts for women.
Alongside the social impact, her work was also very influential politically. She worked to increase the political representation of women and minorities in leadership positions in healthcare and public health organizations, as she was the first Latina president of the American Public Health Association. She also received the Presidential Citizens Medal for her work. Her efforts helped to increase awareness and support for reproductive rights, which were a key political issue for women's empowerment, and her work helped advance the cause of women's empowerment and to create a more just and equitable society for all.
Fun facts. Born July 7th, 1929, is a Cancer sign. Died December 27th, 2001. One sibling, Gladys Hilera. Spouse, Edward Gonzalez Jr. She worked with kids, women, and people with AIDS and HIV, as well as the poor people. Fun facts. Her inspiration was, I wanted to be a physician because medicine combined with things that I loved the most, science and people. In 2001, she won a medal for the principal citizen helping kids and women, people with AIDS and HIV, as well as the poor.